People with BPD are lacking skills, not ability. Let's look at that by addressing how DBT helps with trauma-related symptoms. So Dialectical Behavior Therapy was specifically designed by Dr. Marsha Linehan to treat BPD and its trauma-driven symptoms by addressing the core issue of emotion dysregulation. Dr. Linehan developed this model after being in the hospital for over 2 years herself, by the way. So DBT operates on this principle that the person with BPD has a biological vulnerability toward experiencing intense emotions and just lacks the skills to manage them. And that's often due to an invalidating or traumatic environment that they grew up in. So DBT is structured around 4 main skill modules, and each one of those directly addresses a specific area of trauma response and emotional instability in BPD. So the first core symptom is affective instability. And we're going to use mindfulness to help with this. And that's all about how to notice, label, and accept the present moment without judgment. It helps with BPD because it interrupts the emotional escalation by teaching the person to observe a feeling without immediately acting on it. And that creates a space between the emotion and their response. Next is emotion regulation. So these skills help to decrease the intensity of unwanted emotions, reduce emotional vulnerability, and change unwanted emotions. So this reduces suffering in BPD because it directly addresses that high reactivity emotionally and the slow return to baseline by teaching techniques to soothe the nervous system and manage your triggers. The second core symptom is impulsivity and self-harm. Here we're going to work on distress tolerance. So these skills are designed to help you survive a crisis without making things worse. It's the ability to tolerate those painful emotions when you can't immediately change the situation. So a continuum of acceptance versus change, things you have to accept, things you can change. That's how DBT is constructed. So this replaces maladaptive coping in BPD because it teaches alternatives to self-harm, substance, suicidal behavior, so the person can ride out the emotional wave. The third core symptom is unstable relationships and fear of abandonment. So these behaviors evolved as desperate attempts to escape intense emotional pain. These issues stem from poor interpersonal skills and extreme black and white thinking about others, what's also called binary thinking or absolutist thinking. Then there's interpersonal effectiveness. So this is teaching skills for asking for what you need, saying no effectively, and maintaining your self-respect in relationships, because that's important as well. It helps build healthy relationships because it teaches you how to manage conflict, articulate your needs effectively, and then also validate other people. What that then does is it reduces frantic, clingy, or aggressive behaviors that are driven by this fear of abandonment. The fourth core symptom is identity disturbance and chronic emptiness. So while that's not a separate module in DBT, the entire process of DBT, especially the focus on like radical acceptance and building a life worth living, addresses the core existential emptiness and instability. So by building competence in skills, the person develops a stable sense of self-efficacy. They feel effective in their environment. Mindfulness and radical acceptance help the person accept their trauma history and emotional reality, which leads to a more coherent and validated sense of self. So that becomes more solid. So overall, DBT provides a structured, skills-based approach that helps people with BPD rebuild the emotional foundation and do what's called social scaffolding, which they were unable to form due to their trauma and invalidating environment. So we're talking all about this in my BPD skills group. It's a subscription group, and if you're not in there already, make sure you head over and get yourself signed up. Your first 7 days are on me.